So this is Michigan, huh? There's a lot of snow.
It's called the winter.
Can't you make a left and go to Hawaii? This place is impossibly cold.
Wait a minute, we're fogging up a little bit, brother. Hold on, let's do those two.
Anyway.
Oh, we're sliding. Hold
Oh
on.
my God, can you drive in the snow? Paul's about as good at driving as he is at dieting. And we all know how good he is at that. We're here to see Kelsey. Remember, Kelsey is that 24-year-old girl who basically was born with essentially no breast tissue.
Okay.
So she's got hypoplastic breast syndrome, which essentially means she has tuberous breasts that wanted to develop into breasts, but they never did. So this is actually, sometimes this isn't very fixable. Kelsey has something we call glandular failure. She was essentially born with no breast tissue, and that's why she couldn't breastfeed at all. She's got a very significant cosmetic problem. She's got a very significant medical problem, and I hope we can help her.
You ready to go out and hit some of that weather?
Yeah. No, I'm not ready. Wait a second. Hold on a minute. Not ready. It's cold out there.
Let's go. I'm not waiting for you anymore.
They make
go.
outdoor
Get
heaters.
Get out of the car. Get out. Come hither. But don't trip on the ice.
Hello.
Hi.
Welcome
How
to
are you?
Michigan. Come on in.
Hi, I'm Dr. Nassif.
I'm Kathy.
Terry Dubrow, nice to meet you.
Come on in.
Oh, great. Come on in, Uncle Terry.
Come on in. I'll
Well,
take your coats.
Oh, yes.
Are
you
you
have
enjoying the
coat warmers?
snow?
Oh, it's great. I love the cold.
He's a real California boy.
This is my daughter, Kelsey.
Kelsey, hi, Dr.
Kelsey,
Nassif.
nice to meet you.
Hi, Kelsey. I'm Terry Dubrow. Nice to meet you.
David?
Nice to meet you.
Hey, David.
you
Terry
too.
Dubrow. Nice to meet you.
I am really excited about the doctors coming to see me. I've wanted this opportunity since I was 10 years old, and I'm really hoping they can do something.
So we know a little bit about what's been going on with you and your chest situation.
Yeah.
But in order to really understand how this has impacted your life, we want to go back to the beginning, okay?
I started getting boobs probably like 10 years old. By 14, my right one had developed a little bit of breast tissue, but the left one was still the exact same as 10 years old. When I was 14, I just remember my friends being like, oh, look at this top. And they were all like, had low cut shirts on. And I just figured, well, maybe mine are eventually gonna grow. 14 went by, 15 went by, 16. And eventually I was like, all right, I guess it's stuck like this.
That couldn't have been easy when your girlfriends are
No,
developing.
I did a lot of covering up and hiding it for a lot of years. I mean, it's been very hard to grow up and hide my entire life. I mean, it's something thank you. It's something that I've always wanted was to get them fixed, and to hide them all these years, it's really hard. To go your whole life like that, it's really hard. You don't feel like a woman. Like you see all these other girls wear like low cut stuff, and I'm over here like hiding, trying to make sure that nobody finds out about it. The fact that one is bigger than the other one never developed, and how the nipples just are so swollen and red looking.
Right.
I just want that not to look like that. It wasn't until I was 20 that I was legitimately gonna go do the breast implants. But my dad told me that I should not do it because I would become a stripper. I was kind of finishing college at the time. I met David, so I just kind of gave up on my boob job dream. I mean, I didn't show you for a long time.
When we started talking, I was overseas on business for an extended period of time, and we developed a relationship that was long distance. So when I came back, I had already fallen in love with her as a person. You know, the physical traits, I knew she was beautiful. But you could tell when we, obviously started to get intimate that it was something she didn't expose. I never made a big deal. It's never been a big deal for me, period.
Right.
I can tell that it's been a big deal for her. If she didn't get breast implants, totally fine. But if it makes Kelsey happy, I'm totally for her getting breast implants. I want her to be happy, and that's all that matters to me.
When did you learn that there was a problem?
When she had her baby, we went to the hospital and she went to breastfeed.
So that must have been
Yeah.
horrible.
It was. A year ago, when I had Hudson, I attempted to breastfeed. That was a complete nightmare. The nurse came in, told me that she had been a nurse for 40-something years, and she knew every trick in the book to breastfeeding. Then she looked at my boobs and literally could not believe what she saw. Literally saw an alien, I'm pretty sure.
So when you're pregnant, do you get any breast engorgement at all?
No, my boobs never changed.
Not-
Not even a little bit.
You clearly have a case of glandular breast failure. Glandular failure essentially means when the breast tissue itself fails to develop. In Kelsey's case, she has actually no breast tissue at all, so she can't breastfeed. We may be able to help her from a cosmetic point of view, but we can't help the medical component of that problem. Obviously, there's nothing we can do about that, and you know that,
Yeah,
right?
I know that,
Yeah.
100%.
So there's that component of your problem. The other component of your problem is a purely sort of cosmetic one, which is obviously the thing that's bothering you the most.
Yeah.
It's not as simple as doing just a breast augmentation. You have to figure out if you put a breast implant in, is it just gonna be a bud on top of an implant?
Yeah, that's what I don't want.
So it begs the question, what do you want?
I just want the most normal looking breasts that you can possibly make me.
So
Most
size
normal.
isn't the
I mean,
issue.
I would like them to be big,
Like how big?
maybe like a D.
Like many patients who have nothing, they want an extreme version of something. Unfortunately, that's what we call an unrealistic expectation.
I always wanted like very big boobs. I think I would be like kind of sad if they were
I
still
don't think
kind
you
of
would.
small. Like, doesn't every girl want big boobs? Like, come on.
We don't want to have the situation where good operation, good result, and unhappy patient. That is the worst. And I always feel like that's my fault when that happens. That means I didn't try to rearrange your thinking or turn you down. What we really need to do is examine you. I'm going to give you a little gown.
Okay.
And if you two could go into the other room and we'll come in and figure out what your options are, okay?
Okay. Yeah, I hope they can fix them. I mean, I would be very upset if they told me that I was stuck like this forever. Then I might just go get a botched boob job and say, whatever, at least I have boobs.
Okay, so first thing is just to do an overall look, all right? Okay, so this almost looks like it has some breast tissue. This one clearly is a complete aplasia of the breast. Aplasia means lack of development. And that's why you couldn't breastfeed at all. Normally, your breast would go like this. Okay, that would be sort of a normal breast shape. So the question is, will this come out with a breast augmentation? It will. It will stretch out. The challenge, though, the more you lower this breast crease in order to accommodate an implant, the greater the chance of what we call a double bubble contour deformity. When you attempt to lower the breast crease too much, you still see the memory of the old crease in the lower part of the breast. I do think we can give you pretty breasts, but I don't know till I'm in there how full we can go in order to maximize your cosmetic result and minimize the chance of a complication without any contour deformities, irregularities, weird creases.
Growing up, I always wanted large breasts because everybody in the public eye had big breasts. My entire life, it's kind of something that I've always dreamt of. But after listening to Dr. Dubrow's explanation on why I can't have D-sized breasts, I'm very grateful that he's doing what he's doing for me.
Great
Pleasure
to meet you.
meeting
Thank
you.
you.
Pleasure. We look forward to seeing you.
Thank you.
You?
Pleasure.
Thank you so
We'll
much.
see you in our
Thank
neck of the
you.
woods, okay?
All right.
I never in my life thought that this day would come. I mean, I'm just a small town girl. Never did I think that somebody would come all the way up to Michigan to see me. I can't even say in words how thankful I am for this opportunity.
Here's my problem with Kelsey. You can take one girl who has exactly this and it expands out. Another girl who has exactly this, and for some reason, just because of her anatomy and physiology, it doesn't expand out. So you just don't really know till you get in there. It's a bit of a mystery. That's why you sort of have to go in open-minded, and you sort of tell her, hey, you get what you get, and you don't get upset. Now that we've seen Kelsey's breasts, we realize although we can't help her with her breastfeeding problem, we may be able to help her achieve a normal breast shape and size.
Hi.
Hi.
I'm Kelsey. I'm here for my surgery with Dr. Dubrow today.
Okay, go ahead and sign in. We'll get you taken right back.
Thank you so much.
You're welcome.
I'm super excited. I'm not nervous at all. I'm just ready to get this done with today. Let's go.
Kelsey,
Hi.
how are you?
Nice to see you again.
Nice to see you. We have some talking to do. Your situation, obviously, you have what's called hypoplastic breasts.
Yes.
You do have a anatomical variant where you have that protruding part of the areola,
Yeah.
right? So we have to address that.
Yes.
And we have to address what size we can achieve.
Yeah.
Now, the larger we go, the greater the chance that you will suffer a complication. I know you wanted to be quite large previously, right? So
Not anymore. I kind of rethought about everything that Dr. Dubrow told me, and I decided that I would like a lot smaller boob, just so they look natural. I can still be active. I don't want big, giant boobs that are gonna cause a lot of problems in the end.
you want me to optimize size and minimize risk.
Yes.
Yes?
Yes.
Tell me what your wish, what's at top of your wish list?
Probably a small C.
Okay, let's do it.
All right.
Normally when we do a breast augmentation, we augment a person's natural breast tissue. Kelsey doesn't have any. So we're basically putting a mound underneath rather tight skin. That can predispose her to a complication. So the fact she's willing to go smaller is very helpful and will help to minimize the chance of a problem. For Kelsey's surgery today, I'm going to start by making incisions below her nipples. Next, I'll create breast pockets under her muscle and then place 2 appropriately sized implants inside her chest. Finally, I'll remove skin from her nipples so they lay flat. Okay, are we ready for this?
Let's do it.
So we're basically going to make breasts where there are no breasts. Now, what we're going to do is elevate up a pocket under the muscle in order that it's not directly underneath the skin. Normally I use the breast tissue as much as possible to cover the implant, but because Kelsey has hypoplastic breasts, I need as much muscle coverage as possible to provide protection from the outside surface. Okay, so this is a 310 cc. It's very full and it's perfect for someone with no breast tissue. Hopefully her skin will accommodate this and allow expansion of the lower parts of the breast pole where she doesn't have any breast. All right, let's see. It's a little tight. I want to release this muscle a little more. If the implant pocket is too tight, that sets Kelsey up for a major scar tissue complication. So I need to make sure there's an open, ample pocket for the implant to sit in there comfortably. It's good, right?
Really good.
Let's sit her up and see what that looks like. Okay, so on the right side, the areola is still a little bit prominent. See it? Why don't we do a small areolar reduction on the right side just to de-telescope it? Because of Kelsey's tubular breast shape, her areolas are sticking out prominently. So I'm gonna have to remove some tissue in order that they lay flat and they look normal and more feminine. We put the implants in under the muscle. She's a small C. We've reduced the areola. I don't want to use the P word, but this is about as close to perfect as you can possibly get. Yeah, Kelsey now has breasts, and they actually look like natural breasts. So thank you.
Hello.
Hey.
Hi.
How are
Kelsey,
you?
nice to see you.
See you.
Hey,
Hi.
how are you?
Good. How are you?
How do you feel?
I feel like $1 million. Yesterday was my surgery, and today I feel amazing. I thought it was going to be a lot worse than it was, but I mean, I barely have any pain for what he has done to me.
Let's talk about your surgery, okay? My challenge was to create a pocket that allowed an implant that looked like a breast. At first, I thought I was gonna go in and do a small B, like a 200, 225. I got a 310 in there.
Really?
310.
That's like a small C.
That's like a small C.
Yeah. I'm very happy he could get me to a small C. Anybody can have B boobs. Like C, I can have C now. It's way better.
So you can see.
Yeah, they look bigger already. I keep staring at myself in the mirror.
They
Look great to me.
To look down and see that, it's pretty awesome.
I already feel more confident. I've only had them for 24 hours.
They actually look smaller than they're going to look, and I'll
Yeah.
tell you why. This central portion swells. Once that goes down,
They're gonna be bigger?
this will appear more projecting. These breast implants are what we call ultra high profile. They're designed for someone like Kelsey's breasts, which are very narrow and require more projection. I know that once the swelling goes down, they'll be a full C like they were on the table, and Kelsey will be very happy. I'm very optimistic for a really
Yeah.
amazing
I am
result.
too.
Yeah.
Pleasure seeing you.
Thank you so much. I appreciate
Thank you
it.
again. Appreciate it.
I definitely feel more feminine. I just feel like a woman. Like I can just walk straighter and more confident. Can't wait to wear a bathing suit.
Couple weeks, we'll go get you some new bathing suits.
I'm gonna need a whole new wardrobe.
Is she in there getting ready? She needs to come out.
Yeah, she does. We're ready to eat this cake, aren't we, Huts? Celebrate your birthday.
Today is Hudson's first birthday party, and today's the first day I'm really dressing up and showing my friends and family my new assets.
Kelsey's started to finally feel back to normal now. Feels a lot better.
After I had Hudson, I was at my lowest point. They diagnosed me with hypoplastic breasts and told me that I was not going to be able to breastfeed, and that was devastating. So today's the first day that I get to feel like a real woman.
Oh, there you are.
Oh, clap, Huts! Yay! You look beautiful, baby.
I've seen Kelsey look beautiful, but man, this is a new level. Kelsey looks absolutely gorgeous and stunning today.
I never thought that this day would come that I felt this happy in my own body. And I'm finally glad that I can feel so confident every day. Before my surgery with Dr. Dubrow, my chest was extremely flat. I had weird, strange, awkward nipples. After my surgery, I have really great full breasts. My nipples lay flat. I feel extremely feminine. I feel like I just want to wear no clothes. Who needs clothes anymore? Thank you guys so much for coming to see me and spending the day with Hudson. I'm very thankful for this. Thank you so much. I feel so much better about myself. I'm just looking forward to living life, and I'm finally the woman that I want to be.
Yeah, clap,